Good day, everyone. It's me, Quratulain, clinical psychologist and personal therapist. First of all, welcome you all in our another class for the clinical course in the treatment management for the psychopathology. All right. So today we are going to talk about another kind of disorders that are learning disorders. Let's just start our class. When we are talking about the learning disorder, it actually means a disorder that develops after the client's or the individual learning period starts. When a person learning period starts, when he gets involved in particular activities or when he gets involved in kind of like communication or the complex communication, right? For example, when he goes to school, when he start reading, when he start babbling, when he primarily start computing or numerics, right? So recently there have been a lot of evidences about the inadequate development in certain individuals regarding the lack or regarding the inadequate development in their particular areas regarding their academic, regarding their language, speech, or motor skills, as we had talked about, their primarily complex communication, right? So, what are these? They can include your arithmetic, reading, right? So, it's not particularly due to any kind of mental retardation or any other kind of neurodevelopmental disorder or any physical or you can say the physiological cause. It's actually not about the lack of educational opportunities. Individuals personally just have a very much average IQ. All right. They are often identified or even treated in the schools by the local educational experts or the social experts, but actually they have a very much common cause, or you can say a very much common problem which are normally undiagnosed. All right. So in 2017, the stage of learning disabilities was reported by the National Center of Learning Disabilities. And they even indicated that there are specific kind of learning disorders and they have a very much prevalence among the children. All right. They were basically named as dyslexia, which was contained about 5 to 17% of the children. Dysgraphia, that was obtained to be scored between the 7 to 15% of the average population. Dyscalculia, that was found to be 5 to 7% among the people. What is dyslexia? The question rises here. We are talking about the learning disorders, but what we are calling dyslexia, dysgraphia, dyscalculia, what are these? So, this dyslexia is basically a learning disability that is actually regarding the spelling, word recognition, accurate word speech, all right, the sound structure, okay? Like there are certain signs for the dyslexia: slow reading, incorrect pronunciations, use of wrong words, all right? Inability to distinguish a certain letters, certain sounds, and even sometimes the both problems can be present in a single individual. All right. So you can see there are certain sounds, right? B, s, d, right? These are the particular sounds or the phonemes, or you can say the mnemonics for the words, right? But in certain children, they are not able enough to pronounce certain words, right? Like normally they can't pronounce d, right? They can't pronounce t, r, that is a particular symptom regarding the dyslexia. All right. They can use to pronounce wrong words. They can be unable to distinguish between the letters or the sound sometimes. They can't even recognize certain letters. They can't actually recognize S sometimes, sometimes A or O. All right. They can't differentiate between A and O. All right. What is dysgraphia? We have talked about dysgraphia, right? What term it is actually. Dysgraphia is actually regarding an impaired ability to form certain symbols when you are writing. Graph means writing, right? So that is basically an individual impairment to form or to write certain symbols. All right. Both written letters or numbers can be included or can be affected by this kind of problem. All right. So the common symptoms include the uncomfortable positioning or gripping of the pencil, right? Inverse or letters or numbers, Ill- illegible handwriting, poor shaped symbols, challenging with the written through organization. All right. For example, the children having the dysgraphia, they are not usually able enough to write the S like it has been written here. All right. Or it has been written in the numbers right here. Okay. They're not able to write it down like this. They usually write it in the inverse form or in the horizontal form. They're not even eligible for that. All right. They have a very poor shape writing grip. They're not even sometimes able enough to position their pencil very well. All right. So what is dyscalculia? Okay. Dyscalculia is actually seems to be related to the maths. Calculia means calculations, numerics. All right. So it may be a deficit in the ability to quantify the numerics and numerical operations. Okay. The symptoms of the dyscalculia is related to the counting, to putting numbers into the symbols, right? Memorizing the number sequences, calculating the squares, all right? Um, Looking forward towards the addition, towards the demas. They can't remember the sequence very well, all right? They're not able enough to memorize it very well. Comparing to the quantities or the large to small numbers, they are not able enough to distinguish the ascending order or descending order we normally do in our early schoolings, right? That is a very basic knowledge, but they're not able enough to actually put it down in a very regular way, all right? So in the DSM-5 TR right now, we have been practicing or we have been naming these kind of problems as a specific learning disorder. Specific was actually named because there are certain, or you can say the particular population who normally have a very particular kind of problem. All right. If we are just naming it as a learning disorder, we are not able enough to distinguish which one. Either is it dyslexia, it's related to the reading, obviously. Either it's dysgraphia, it's also automatically related to the numerics. Either it's dyscalculia, then it's obviously related to the mathematicians, right? Mathematics. They're not able enough to distinguish between them. So that's why it was named as the specific learning disorder. All right. It's very much inconsistent with the person's age, with the schooling, or with the intelligence. Okay. So dyscalculia or dyslexia is no longer distinguished diagnosis. Okay. Specifiers are included in the DSM-5 TR for reading or writing expressions or the mathematics, obviously. But you have to remember one thing, that if the symptom has been persistent for the last 6 months, then it will be considered in this category of disorders. All right. Here are some studies regarding the, you can say, the identification or the physiology of learning disorders. All right. These are the primary lobes related to the learning disorders. It will include parietal lobe, frontal lobe, and the temporal lobe. The studies, neurological studies, have been found to implicate that actually these two or three particular areas are actually responsible for these kind of disturbances in the individual. These are a very much, you can say, a precise image for you guys to understand that where are the areas that are primarily responsible for the disturbances related to the particular disorders. For example, the position of the emotional disorders, the disorders related to the moods or the emotions, are located here because it's very much above to the hippocampus, hypothalamus, right? Or pituitary gland. It's the area here, right? So obviously, we are very much able enough to remember that it's regarding the emotional disorders, right? Here, it's the pituitary gland, right? The hormonal issue or neurotransmitter related problems, right? They are obviously very much reasons for the seizures sometimes. So here it has been named as seizure here, okay? The problems in the, you can see the, regarding the stroke issues are very much located here. The area has been found here, okay? Alzheimer. Frontal lobe have been found responsible for the memory, right? So allocation, understanding, remembrance, and retriggering the memory is allocated in the frontal lobe. So in case of Alzheimer's, we know it's a neurodegenerative disorder. So the problem starts here in the frontal lobe. And that's the reason that the degeneration of the memory recalling starts. All right. Here is the learning disability. We have been talking about the learning disability, but for the regard of your knowledge and for the regard of your better understanding, I used to describe these particular disorders. Here comes the learning disability. All right. So learning disability is basically, you can say that the area is very much particular about the parietal lobe or the temporal lobe. So much of the complex form, right? So basically, the problem starts here. A person's neurological issues begin to arouse these kind of disability. All right. So here comes the etiology, or you can say the causes behind the learning disabilities. Either it's the impairment in an individual ability to read, to write, or to comprehend. All right. So we are particularly talking about the impairment in the reading right now. The genetic factors, or you can say the genetic reasons, have been found to be very much evident about the twin studies. All right. And they have found a generalistic, or you can say a very much common genes among them to be the reason for the reading impairment. As much as that, speech perception, or you can say the difficulty in reorganizing and recognizing the rhymes or the alliterations, have also been found in the twin studies. So deficiency in the phonological awareness or inadequate left temporal lobe, parietal lobe, and occipital lobe activation was found to be very much reason of the reading impairment in the twins lately. Now we would be talking about the causes of the learning disability, specifically about the mathematics or the dyscalculia, right? The genetic or the biological factors have been found to be determined in the twin studies, and they have found a very much common genetic factors in both reading as well as the mathematics, or you can say that that's dyscalculia deficits. All right. Intraparietal sulcus implicated. That is actually a point that intraparietal means between or among the parietal region, right? Sulcus is a particular area in the parietal region responsible for the mathematic calculations, right? that area was found to be implicated for the dyscalculia or the impairment in the mathematics or the calculations or the numerics sometimes, right? So they found a very much cognitive deficits for the dyscalculia or even the dyslexia in case of twin studies. Here are the very much intrigued version for you guys to understand the causes of this disability. Premature or the post-mature, you can say the period, they found a low birth weight, mother's labor difficulty, and the birth injury during the perinatal care was found to be responsible for the learning disability and actually intellectual disability lately as well. All right. During the postnatal care, if a child is having meningitis, that is a kind of brain infection. All right. Meninges are the particular layers for you guys to understand in the above the skull to actually, you can say, to connect between the skull and your particular capillaries over the skin. All right. And to, you can say, the cushion between the skull and your body. The infection there causes certain kind of problems, including the learning disabilities as well, obviously. Any kind of brain injury during the client's childhood, a very much exposure to the toxin regarding the mercury. It can be sometimes activated iron. So anoxia is basically, you can say, the when the baby born, and sometimes it has been reported that the baby turned blue after his birth. That is basically anoxia. Due to the lack of oxygen at that moment, some babies gets blue. All right. And due to the lack of oxygen, there are particular neurological issues that can develop. All right, including the learning disability and as well as the intellectual disability. All right. So these are the particular disorders. Sometimes they get confused and people just mix that up. So we have formulated them here at one page to actually make you guys understand it better. We have talked about dyslexia and dyscalculia. Now we are going to talk about what is communication. All right. Speech sound disorders are basically disorders related to the phonological phenomena. All right. They involve correct comprehension, or you can say the vocabulary use. But in case of speech sound disorder, basically, a client used to have an unclear speech and inappropriate articulation, pronunciation. All right. Speech is the pronunciation or the production of sound of that word. All right. They would say a boo for the blue. Rabbit would be pronounced by them as wabbit. All right. So they need a very much a long term of speech therapy for that purpose. Here comes another disorder. Students normally get confused about it, how to actually differentiate it from other learning disorders. That is the childhood onset fluency disorder, or the stuttering we normally describe it as. It's actually a disturbance in the verbal fluency, right? And sometimes it gets involved in the long-term speech patterns for the frequent repetition, for the prolonged sounds, sometimes the long pauses between the words, sometimes substituting the easy words for those that are difficult to articulate. All right. For example, for particular consonants. All right. So instead of saying go, they would just used to say go, 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 go. Right. They would be repeating those words, the particular words. All right. So what is language disorder then? We have talked about the pronunciation problem. We have talked about the fluency problem. All right. We have talked about the learning disorders. So what is language then? Language is actually you can say the combination of your expression and as well as your reception for the expressive sounds. All right. That was actually a kind of problem that was actually included in the DSM-4, but right now it's very much implicated in other kind of disorders lately, including the social pragmatic disorder, or sometimes in the uh, specific learning disorders as well. You can see certain symptoms regarding that. All right. So here it comes. We have talked about the learning, specific learning disabilities. We have talked about their etiologies. We have talked about their basic concepts to differentiate what actually they are. So there are certain disorders that are sometimes found to be very much comorbid with the specific learning disabilities. All right, including attention deficit hyperactivity disorder, including the DLD. All right, including SLCM. That is basically a kind of problem related to communication, okay, related to some kind of problems that are basically due to neurological as well as the behavioral issues. So here comes, um, when should you actually consider your child to be tested for the learning disabilities? All right. So basically, if you are, or your client is actually finding his child to be having these kind of particular problems, then I think you should recommend them to look forward for the testing for the learning disabilities. Telling from the left to right is a kind of difficulty, sometimes a complex challenge for them. All right. If they are having problem to reverse certain words or letters or numbers, they are not able to actually go for the reverse numbering, then it's a bit triggering for you. All right. If they are unable to coordinate it very well, they have difficulty for telling the time or the ratios. All right. They have difficulty in writing. If a child is, having a very much good record for the milestones, and you happen to see that it's actually been like, child is not able enough to write it down in a very long term paragraph. If he's in the grade 7 or 8, then you should expect that there is something going on, right? So if a child is having difficulty in remembering the instructions or the steps, right? If they're having difficulty in doing the simple numerics and organizing the numbers, or speaking very well, or memorizing some things, all right. These are the particular problems that are being overviewed here. So you can review it down lately. All right. So what are the particular assessments that are required over the period of time when we are talking about certain disorders? Certain students would used to ask us that how can we actually distinguish that these particular tests are actually the part of the assessment that are required for these particular disorders. So these are certain assessments that would be required for you to understand the child having the learning disability. Intelligence tests are being recommended for this regard because intelligence is also a domain where you can actually understand if a child is not having a very much average IQ, or you can say, I'm not talking about the IQ either. I would say if a child is not doing in the average population, then you have to understand that it's not just regarding the learning, it's more than that, right? It's going to happen in certain other areas. So how to actually assess that problem? That include Wessler intelligence test, all right? If the child is not like the child or the adult, then you can administer the Wessler adult intelligence test, Stanford Binet, or you can say the Stanford Binet intelligence test. We would say it's Stanford Binet test, all right? Cowan assessment battery for the children, differential ability scales, and the cognitive assessment system are the particular tests that are being administered lately. All right. Another one includes the achievement test. Why are these particular tests are important in case of assessing the children having the learning disabilities? Because they help you to understand if your child has a restraint or you can say have able enough to apply the information after a period of learning. All right. So they would be very much convenient for you to understand the learning situation of the child. All right. These tests include the Woodcock Johnson test of achievement, Common test of educational achievement, Wechsler individual achievement test, and scholastic abilities test for the adults. All right. I happen to have shared children as well as tests for the adults here. Another domain you can happen to have assessed in case you are diagnosing or expecting a person with a learning disability. That is the visual motor functioning test. Here, uh, they would help you to determine that how well a child can incorporate the motor skills with their visual skills. All right, how much they are able enough to communicate these two skills together. All right, so their abilities will be accessible either in the handwriting and drawing, also as well as for non-verbal learning issues. All right, so these are the one of the most commonly used visual motor functioning tests, including the Barry-Buctinia developmental test, as well as another one is Bandus Gestalt test. In the South Asia right now, Bandus Gestalt test is one of the most practiced tests there, right? So here come the language tests. These are particularly regarding the language evaluation, all right? Language tests would help the practitioner to understand how well the child understand what they have read. All right, they are able enough to comprehend that. They are able enough to actually communicate their idea, what they have gone through, that particular knowledge. All right. So these tests includes the clinical evaluation of the language fundamentals, Goldman Fristo test for the articulation, expressive picture vocabulary test, Peabody picture vocabulary test, and the preschool language scales. I hope these skills will be very new for you guys to understand that these are the particular assessment tests you can do in case you are actually working on the children to diagnose with the learning disability. So we have talked lately about the learning disabilities concept, about the diagnosis of the learning disability, the framework of the learning disability. We have talked about the behavioral manifestation overall, as well as associated disorders, or you can say the comorbid disorders. We have talked about the causes and etiology as well. Now, if the problem has risen, obviously we have to move forward towards the management or the particular treatment regarding that. Overall, there is no particular psychopharmacological medications for the learning disorders specifically. But yes, there are certain management plans here in the psych evaluations for the children to overcome these particular barriers. That will include specifically for the reading and writing specifiers, there are multisensory instructions where actually you can instruct them by verbal, or you can say by words, as well as you have to prompt them with your hands. All right, including your speech or writing skills, right? Then you can work on their readiness skills, including the what are actually the readiness skills, right? The question rises here. These skills are actually about command following, eye contact, attention, compliance, and on-setting behaviors. All right. These are the five particular skills that are overall embedded in the readiness skills. You can work on that. All right. And you would find it lately that they are very much good for the children having the learning disabilities to work on. Then comes the phonic instructions. These are very much related to the speech therapist, but yes, we happen to have a very much knowledge about it, and you can actually start practicing phonic instructions with the children's having the reading as well as the writing issues. All right. Then if a child is having problem with the writing or having the calculation regarding issues, then these are particular practices that he can particularly do, especially in the adolescence. All right. Summarization is a technique where he happened to have summarize the whole idea he have studied, repeat and repeat again. All right. Do it again and again and summarize it. So it will be very much helpful for him to understand and to memorize it carefully. Then the second one is self explanation. All right. You can happen to have just write this certain particular ideas and you can just explain them very well. All right. In case of presentations, for example, we have put some points here, but we are explaining them to you in a very detailed version. That is another form of self explanation. All right. Then comes the keywords mnemonics. You can give them the idea about the prompt memory. All right. Then here comes visual image. All right. We are very well aware of the learning disability and the intellectual disability, and we can differentiate between them, right? So visual imagery is very much practicable for the children having learning disabilities. All right. So for the children having the communication issues as well, like with the learning disabilities, there is another technique they can be used, that is the fast forward. All right. There are particular softwares or the games in the um, present era that happen to have this software that is the fast forward. All right. Or the audio tapes that actually slow down the speech of another person for those particular individuals having the learning disability. All right. We have been communicating, right? But I'm speaking so much in the fluent way that a student have reported that your accent sounds to be fake, right? The reason is because I'm speaking it so much fluently. All right. So for those who are having problem of the learning disability, they happen to have certain software like the fast forward, where the software will slow down the speech for them and they will perceive it very slowly, like involve computer games and audio tapes that slow down speech sounds. So these kinds of software actually change that particular thing to so likely that they can actually go it down very well. Right? What the parents can do. As a parent, they're having a children with the learning disability, what they can do, right? They can educate themselves about the diagnosis. They can involve their children in the support network. All right. They can regularly communicate with their children's teacher, with their child's educational expert. All right. Encourage your child for the open communication about the diagnosis. It's very normal to have such kind of problem as the fever or the flu, right? So you can inspire your child with certain examples of the individuals who happen to have certain other big issues and they have gone through it very well.